Hello, welcome to Rapid Medicine Episode 1. In this episode, we'll be discussing high-yield topics in psychopharmacology and schizophrenia. These questions are designed to help students taking both Step 1 and 2, as well as COMLEX Level 1 and 2. Alright, let's get started with question number 1. Question number 1 says, what is the time requirement for a diagnosis of schizophrenia? Feel free to pause the video after each question and think about your answer. So the answer to that is going to be greater than 6 months. So this is a very high yield timeline to understand and know. Anything less than 1 month that is on the schizophrenic spectrum is going to be classified as a brief psychotic disorder. Anything greater than 1 month but less than 6 months is considered schizophreniform disorder. And anything greater than 6 months is considered schizophrenia. It's also high yield to know that most schizophreniform patients will progress eventually into schizophrenia later on down the road. Question number 2 states, what % of the population at any given time will have schizophrenia? And the answer to that is 1%. In general, across the board, 1% of the population is going to have schizophrenia at any time. An example that can be seen on a board test or a shelf exam in psychiatry would be, they give you some town has a population of 5,000 people, and then they want you to say how many people in that town will likely have schizophrenia. So what you need to know is across the board, 1% of the people have it. So take the number of people in the town times by 1%, and that will give you 50 people. So question number 3 states, what brain abnormality is seen on CT MRI imaging in a schizophrenic patient? So the answer that you're looking for is a ventricular enlargement. The image that's showing up on the right side of the screen here is showing lateral ventricular enlargement on the midline in a schizophrenic patient compared to the normal lateral ventricle size in a healthy brain on the right side. Question number 4. What is the mechanism of action for first generation, or also known as typical antipsychotics? The answer is dopamine antagonist. And it's specific to D2 antagonists. You probably don't need to know that. Just remember dopamine antagonist. And the reason is the side effect profile for antipsychotics is highly revolved around the dopamine antagonism. You get these extrapyramidal symptoms due to the antipsychotic's effect on the dopamine receptors. So that's, you're going to get things such as tardive dyskinesia, akathisia, Parkinsonism, those types of things. And question 5 is saying, what is the mechanism of action for second generation or atypical antipsychotics? And the answer you're looking for here is compared to typical antipsychotics, the atypicals are going to have antagonistic effects on the serotonin and the dopamine receptors, and a much lesser degree on the dopamine receptors compared to the first generations. And the reason that this is important is, as we said in the previous question, first generation antipsychotics are highly associated with extrapyramidal symptoms such as the tardive dyskinesias and the Parkinsonisms. And these guys, the second generations, have a much weaker association with extrapyramidal symptoms. Question 6 says, which antipsychotic drug is associated with agranulocytosis? And the answer is clozapine. So agranulocytosis, all that means is there's a neutropenia or a lack of neutrophils within the bloodstream. Clozapine is highly associated with agranulocytosis. It's so severe that, in fact, when you first start the drug, you need to have weekly blood draws just to make sure that the person isn't losing neutrophils at a rapid rate. And the other drugs that will pop up on board exams that are associated with agranulocytosis is carbamazepine, methimazole, and propylthiouracil. The methimazole and the propylthiouracil are both used when someone is having hyperthyroidism. Carbamazepine is used for an anti-epileptic drug. And so it's always good to group things together when you can. And so anytime you see agranulocytosis, you need to be thinking about these 4 drugs here. Question number 7. If a patient was started on an antipsychotic and 2 weeks later went into ventricular fibrillation, what drug was most likely given? So the answer you're looking for here is ziprasidone. Ziprasidone is a second generation or atypical antipsychotic, and it is highly associated with prolongation of the QTC. What can happen is the patient can go into ventricular tachycardia and progress into ventricular fibrillation or torsades de Pointes. Question number 8. What is the diagnosis when a patient presents with a sudden, sustained contraction of the neck after taking haloperidol for the last 2 weeks? So what has happened is this patient has acquired acute dystonia. And so how you get acute dystonia is you need to be thinking of a high potency first generation antipsychotic. Remember we said that they are having antagonistic effects on the D2 receptor, and it is causing contraction, most commonly in the neck. It can be within the eyes, but most commonly you'll see it on boards within the neck. So question number 9, what is the treatment for acute dystonia? So the answer you're looking for on the test is diphenhydramine or benztropine. Either one of these are acceptable answer choices. Most commonly, you're going to have diphenhydramine lying around somewhere in the emergency room, so that's probably going to be the go-to option. The reason you want to give either one of these 2 drugs is because they have anticholinergic action. So if you're having sustained muscle contraction, this is all being done with cholinergic receptors. So what you want to do is you want to antagonize that receptor and allow for a relaxation of that contracted muscle. So question number 10. What is the diagnosis when a patient presents with sudden inability to sit still or restlessness following antipsychotic administration? And the answer here is this is known as akathisia. And so akathisia just means someone is just not able to sit still. They might be walking back and forth, pacing back and forth. They might be having to go outside and go on long walks. Be looking for something like that within the question stem, and also be looking for, hey, were they just started on a recent antipsychotic within the last week or 2? Those are going to be your big hints to what is going on here. Question number 11. What is the treatment for akathisia? So you've identified it in the question, you know exactly what's going on, and now they want to ask you a second order question. How do you want to treat this person that is restless and can't sit still? So the answer is, first line you want to get the beta blocker, and it is most commonly propranolol is the expected answer choice. If you do not see that, look for a benzo, most commonly lorazepam, and if they're being turds, the third order is benztropine. And all these are acceptable options, but definitely be looking for propranolol first. Question number 12. What is the treatment for neuroleptic malignant syndrome? And the answer here is, first you want to stop the offending drug. So you want to stop the antipsychotic that they have been recently placed on. If their vitals are unstable, you want to begin a benzo to level them out. And if they're still not being contained, you want to start dantrolene or bromocriptine. And so neuroleptic malignant syndrome, it is a medical emergency. These people are going to have highly increased muscle rigidity. You will not be able to flex their arms or anything like that. It's known as lead pipe rigidity. You'll also be looking for, in a question stem, increased creatine kinase due to muscle breakdown. And compared to serotonin syndrome, these patients will not have increased reflexes and they will not have myoclonus. So once again, your key to knowing that neuroleptic malignant syndrome is the answer is muscle rigidity and increased creatine kinase within the blood, and that they had recently been started on antipsychotic. So question 13, what is the first line treatment for catatonia? So the first line treatment for catatonia is a benzo, and specifically lorazepam is the answer that you're looking for. In refractory cases, you want to look for ECT therapy to get these guys out of the funk that they're in. And if you don't know what catatonia is, it is when patients sit unresponsive for hours at a time. They are still believed to be awake, but they do not respond to external stimuli. They can have what's called waxy catatonia, where they just kind of, you can move their arms and stuff into certain positions and they just stay there for hours on end. Question number 14. What antipsychotic drug is the most correlated to hyperprolactinemia? So the drug you're looking for here is risperidone. Without a doubt, anytime someone gives you lactating or lactation in a male or lactation in a non-pregnant female that has just been started on antipsychotic, you need to be thinking risperidone. And the reason is risperidone is highly antagonistic to the dopamine receptor. And if you remember back to physiology, dopamine is what is inhibiting prolactin. So if I inhibit the dopamine, prolactin is going to be elevated. And that's why I have lactation with risperidone. All right, our last question of the video, question number 15. Which neurocognitive disorder is associated with increased sensitivity to antipsychotics? And the answer we're looking for here is Lewy body dementia. This is a very high yield fact to store away. Anytime an antipsychotic is given, especially a first generation, Lewy body dementia patients will have an increase in the symptoms that they display. And the triad of symptoms that you need to commit to memory are visual hallucinations, dementia, and in advanced stages, Parkinson-like symptoms. The visual hallucinations that are displayed in these patients are usually revolving around some type of furry animal at the foot of their bed, such as like a cat or a dog or something like that. And they will always be clear to point out in the question stem that these patients do not own a cat or a dog, so always be on the lookout for something along those lines. Well, thank you guys for watching the video. I hope you enjoyed. Please feel free to like and subscribe and leave a comment. Thank you very much. See you next time.